Okay, so continuing in this series, we'll now be discussing questions from 2024 NEET paper, pharmacology paper. So the first question is, which of the following drugs used in the treatment of diabetes is used to cause urinary tract infections? Now your options are gliflozins, gliptins, pioglitazone and glimepiride. Now even if you don't know the answer to this question at first, you can guess it from the mechanism of action of these drugs. Now urinary tract infection means that there is some bacterial infestation going on in the urinary tract, right? So what increases the chances of infection in a urinary tract? If there are more sugars flowing in the urine, and which drug increases the levels of sugars in the urine? The answer would be gliflozins. These are SGLT2 inhibitors. Okay, so we should revise all the side effects of these options as well, because anti-diabetic drugs, their mechanism of action, their side effects, all are really important for the INICET paper. Now gliflozins, they act by inhibiting SGLT2. So glucose is not absorbed in the system, back in the system, hence more glucose is lost in the urine. So if more glucose is lost in the urine, what it would cause? It would cause increased incidence of urinary tract infections. Also, if the perineal hygiene is poor, it can increase the incidence of genital infections, and particularly the examiner may give you Fournier's gangrene. Either the examiner may give you Fournier's gangrene, or he or she may give you an image of Fournier's gangrene. So you can comment and tell me what is Fournier's gangrene with abdominal wall involvement known as. So one separate term for there is when along with Fournier's gangrene plus abdominal wall involvement is there. So you can tell me what that is called in the comment section. Next, coming to gliptins. Now to the mechanism of action of these drugs, gliptins. So you will recall that these are incretin related drugs, but if you get confused whether these are DPP4 inhibitors or GLP-1 analogs, you have to focus on this in at the end, which means inhibitors. So these are DPP4 inhibitors. So DPP4 inhibitors, in important side effect is pancreatitis. Another drug for an important side effect for which is pancreatitis is valproate. Okay, so coming back to DPP4 inhibitors, these are weight neutral or they cause weight loss or gain? These are weight neutral because they increase the levels of incretins which are already present there in the body. These are not being given exogenously. An incretin is not being given exogenously, as is the case with GLP-1 analogs like semaglutide, which are being given exogenously and they help in weight loss. Pioglitazone is contraindicated in heart failure. Why? Because it causes fluid retention as well as it increases the case of bladder cancer. Glimepiride may cause hypoglycemia and it causes weight loss or gain. It causes weight gain. So if a thin patient with the diabetes mellitus is there, what is preferred? Glimepiride can be preferred. Now one more side effect which can you can see written in the explanation is euglycemic DKA. So euglycemic DKA also increases with the SGLT2 inhibitors. The reason for this is that SGLT2 inhibitors decouple the blood glucose levels from the blood insulin levels. What does it mean? It means that when you give SGLT2 inhibitor, the blood glucose falls. But this blood glucose fall is not corresponding to increase in insulin. Insulin is not being secreted. The blood glucose is being reduced through a different mechanism. So if blood glucose is decreased but the blood insulin is not increased, then the insulin by glucagon ratio may remain what? May remain low. So insulin by glucagon ratio may remain low, and which is the basic pathophysiology behind DKA. So even if the blood glucose are normal, the patient may end up in DKA. Why? Because the hormonal imbalance is not corrected by these drugs. Only what is corrected? Only the blood glucose levels is corrected. So if a patient who is a diabetic presents with nausea, vomiting, abdominal pain, and the patient is on gliflozin, either of the gliflozins, then an important test would be to do the blood ketone levels or the urinary ketone levels to check for the presence of ketones bodies and rule out DKA, right? So these are the important side effects related to these drugs.